Hello and welcome to my channel. Welcome back and welcome in. I'm Kirsten and today we're going to talk about anal fissures. They are actually more common than you might think, and some people may misdiagnose them as hemorrhoids. So what are they? It's when you have a tearing in the anus, the tissue just as it goes at the entrance of your butthole and also slightly in. And if it's a small anal fissure, then they can heal within a few days to a couple weeks. But if you have one that's not healing, say for 8 weeks, then it's a chronic anal fissure and they have to be treated a certain way. So some clients will come to see me because they have had chronic anal fissures and they are now on the path of trying to manage some of their pelvic tone, because oftentimes a fissure is caused when we're constipated and we have hard poops and we're trying to push that poop out, so we're straining, and that hard poop, it tears that very thin, gentle tissue of the anus. That's the most common way of getting fissures. Also, penetrative sex can create them, and there are also some other infant style things that happen with the gut and whatnot. So most commonly though, it's constipation, hard stools. So we know how to manage constipation, most of us. We drink more water, right? Make sure that we're not dehydrated and get the right amount of fiber. And I've done other videos on that, making sure that you don't whack up your fiber too fast. You could actually become more constipated. So first off, start increasing your water if you're not getting that, say 1.5 to 2 liters. But some of us, depending on our size, might need say 2 to 2.5 liters of water. And start getting nice fiber in your diet and not having things that can burn the tissues like spicy foods. So keeping that at bay. And making sure that you have really good pooping habits. Okay, so one of the things we want to do is to maybe use a little step stool. So call it a squatty potty, right? Where you have a step stool underneath your feet that's about between 8 and 10 inches high. That can help get the bowel into the right position and help you poop. But having said that, some of my clients actually find lifting their knees up towards the chest is more uncomfortable to have a bowel movement, and they need to rock back on the toilet because that helps them have a better evacuation of that bowel. Also things such as IBS, where you might go from a constipated pattern to a loose stools and more like diarrhea, because that can also create some anal fissures. So it can be very uncomfortable to have a poop. So one of the more common treatments is a stool softener. If you can't get the water and the fiber in, making sure that your stools are soft to pass, and that can help with anal fissures. Also supporting the perineum so that you don't feel that stretching and descent as the poop comes out, because oftentimes if there is a problem with constipation, sometimes our bowel will fill up quite a lot and then it feels like a lot of poop comes out at once. So I'm going to turn my back to you and show you my bottom, but we're going to use our hand, and you can put toilet paper on your hand and then you place that between the sits bones and your anus. So you can just gently lift up. So you're not touching the anus is here, and there's your sits bone, and you're just supporting the tissue beside it. And that can give you that sense that it's not coming out and tearing. So you're kind of supporting yourself while you have a poop. Another thing that clients can use if they have it is a bidet. That really seems to help. They can wash and feel a little bit more comfortable afterwards, so they're not wiping too hard on that fissure, because a fissure can tear again, and it can continue bleeding and tearing and being really a real nuisance until you start maybe having to go into the chronic side of things and getting some treatment. Another way that clients can help with the discomfort of that fissure is to have a sitz bath. So oftentimes when you have the poop is when it's most uncomfortable. Some people have a poop once a day, sometimes it's 2 or 3 times a day. So you can sit in a sitz bath, just a low level bath, to help relax, a warm bath to help relax the muscles and to help with the discomfort at the anus. You can be quite low and you can be in there for 15 to 20 minutes, 1 or 2 times a day if that helps too. Sometimes my clients are prescribed lidocaine cream, and they can put lidocaine cream onto the anus if they're about to have a poop and they're just like, so I have one client who it got in her head. She was so worried about having a poo because it hurts so much. It feels like someone's cutting you or tearing you when you have that poo. So she went to the doctor. She got her lidocaine cream, which is a numbing cream, and she put that onto the anus. And that just helped somewhat, doesn't completely eradicate the symptoms, but that helped somewhat to just help her with pooping. So what if you have these, how do you know, actually let's go back. Well, how do you know whether it's a hemorrhoid or an anal fissure? Well, anal fissures tend to really hurt when you're having your poop, right? Because especially if it's hard. If it's softer, then you can sort of start healing it and you're not stretching that tissue out and tearing it. So it tends to be a little bit more episodic, okay? Where when you have hemorrhoids, they can, because the vessel has descended and it is full of blood, it can be throbby. So even if you're like doing lots of exercise, you can sometimes feel throbbing in there. If you're on your feet for a long time, you feel heaviness and throbbing, because the other symptoms are very common. They both bleed when you have a poop, and they both can sort of spot bleed for a little bit afterwards too. And they're both very tender at the anus. And they also have like that bright red blood to them. Okay. So that's way maybe you could sort of figure out whether you have an anal fissure or whether you have a hemorrhoid. But of course, going to your doctor and saying, hey, I've got a sore bottom hole and I want to know whether it's a hemorrhoid or an anal fissure, because the treatment can be quite different. If you do have a chronic fissure, that's where maybe you're going to your doctor. They're going to check what your diet's like, whether you've done some conservative care, and then they can put you on more creams that might help to vasodilate the area, or they might, which is also used for hemorrhoids, but like a nitroglycerin type of thing. Anyway, that's if it's chronic. And where does pelvic floor physiotherapist, like, why am I even talking about this? Because of course I'm looking at that area during the day, and people are I talk to them about their constipation, how are your bowel movements, and do you have any IBS? And they might say, well, I have a fissure that I finally just healed a week ago. Are you going to tear it open? I'm like, no. But when we're constipated and we have pain when we have a poop, like my client that was getting in her head about, oh my gosh, I don't even want to have a poop anymore, it's just so excruciating, her pelvic floor got quite tight. So they'll come to me and I'll go in and I'll start releasing the pelvic floor so we can get that pelvic floor back to a really nice state where it's able to contract and to relax. And remember, the anal sphincter is part of the pelvic floor musculature, and there's many muscles there, but it's part of it. So we can work on getting that muscle to be nice and soft and relaxed and strong, right? We love relaxed and strong, so that they don't have as much difficulty pooping. Because remember, a tight pelvic floor makes it harder to poop, right? So constipation is a sign of a tight pelvic floor. It's not the only reason for constipation is a tight pelvic floor, but when someone says, oh yeah, I've got constipation, I think, oh, I wonder whether I may have a tight pelvic floor, and I have to go in and like get those muscles to kind of relax a little bit better so that they can have a better pooping. But that's where I come in when I have a client that has anal fissures, and I don't go into the anus until they are pretty much asymptomatic, where they don't have pain there anymore. I had one client a couple weeks ago. She was really doing well with her anal fissures. We did the releases, did that vaginally a couple times, treated her and got her like to know how to do a Kegel a little bit better. So she's strengthening the pelvic floor, but not getting tight. And I said, okay, should we work on the back half of the muscles? Should we go into the anus? She said, oh, we can try. But she as I did a digital exam and went to go into the anus, because we also want to address those muscles and check the external anal sphincter. When we went when I went back there, she actually spasmed around my finger. So her muscles all of a sudden tightened up in a muscle guarding, in a fear response. And so it tightened up so much. And then she went, oh, and I went, okay, I'll just gently go back out. And that's a more extreme case. She just tended to have a muscle spasm, and then that caused her to have more discomfort. And of course, if it's painful like that, I'm just, okay, no problem. We'll just leave it to another time, or maybe we never do it. And we just work on all those other factors until that person, their anal fissure has healed, that they know how never, ever, ever to get another anal fissure and have that pain again, and they have a much better functioning pelvic floor. So I hope that's helped, and let me know below if you have had an anal fissure, and if you have any other tips and strategies. I'd love to know about them. And of course, if you like this video, please do give it a thumbs up and subscribe, because that really helps YouTube send this information to other women that might be needing it. Okay, all the very best.